Had been released in Bloemfontein. The commission of inquiry was facilitated by the Treatment Action Campaign and I-quiry. The commission heard testimony from over 100 patients, their family members, health workers and civil servants, and compiled the report entitled Free State in Chains. Our reporter Richard Newton joins us now live from Bloemfontein to give us more on this. Richard, good afternoon to you. So the state of affairs in the health sector in the Free State has come under intense scrutiny of late, leading to this report, but interesting to see you actually set it up, Richard.
Yes, very interesting. Indeed, TAC facilitated and initiated this report. There were 3 independent commissioners who served on this, and they heard in July, they heard testimony from over 100 people telling their stories, some heart-wrenching stories in the report as well. And they have 8 major findings in this report, and they say that this is something that needs urgent attention. Their first finding, they start off by saying that the health department are failing to assume responsibility to protect access to proper health care by the people. In fact, Paul Verreyn, one of the commissioners, said this morning that some of the stories they heard from patients and patients' families bordered on crimes against humanity, and this had to be addressed as soon as possible. The report did come up with a host of recommendations for each of their 8 key findings, but the point they were making was that if we're going to survive as a country, we have to make sure that the most vulnerable actually get the best treatment, and we have to give them access to proper health care across all our services.
So, Richard, now that this information is available, what can we expect to come next, and how soon would we see changes?
Well, the question now is how fast will everyone involved get more involved? The call went out, of course, to government sector, to the healthcare department, provincially and nationally, to look at the recommendations, to look at policies already in place, to look at systems that just need to be properly managed according to this report, and to start work on that straight away. And also, it was made very clear that it can't just be left to government departments to sort it out, that the social activists, that the public communities must all get involved where they can to assist government to implement policies already in place and systems that are there but just not being managed. And we say, the report says this morning that this action needs to be taken sooner rather than later.
So then, Richard, has there been any response from government on this?
Well, there wasn't a government representative at the handing over of the report this morning, something that the Commission said they were deeply disappointed in. We are, in fact, in contact with the department to find out what their reaction is to this report and how it can be taken forward from the department side. Of course, it was made very clear that we're not talking about every hospital, every clinic. There are samples where we have major problems in the province, but there are also those that are working, and the government will also be at pains to point out that the systems are in place and it's not a widespread problem from their side.
All right, Richard, thank you very much. That's our reporter, Richard Newton, coming to us live from Bloemfontein, but staying with issues.